Welcome to Therapist Spotlight.
Hello, everybody, and welcome to Anta's Therapist Spotlight, this podcast where we aim to showcase our wonderful members to the wider community. I'm Joshua Brooks, your host, and today we're here with Jan Deneke. Jan is a clinical nutritionist and a holistic health coach, so this is going to be a wonderful conversation. Jan, how you going?
I'm well. Thank you for the invitation.
Oh, no, it's going to be beautiful. So, first question, what got you into natural therapies?
Well, you might hear my accent. I'm from the Netherlands. So 10 years ago, I moved from the Netherlands here. And I am a yoga teacher. I have my background mainly in publishing. That was in the Netherlands. So when I came over here, I focused a lot on continuing to write for the Netherlands and also to teach yoga. However, I also felt that I wanted to expand my experience more into a realm or into an area where I could do more than just simply teach yoga. Also, thinking more about my own future. Like I wasn't like yoga is a physical practice. It's also quite physical when you're teaching it. So I also wanted to do something that could be like a second career next to what I was doing. And that's when I came across nutritional medicine. And I started to study it just purely because I thought, okay, like diet is a nice addition towards what I'm doing with yoga, not actually knowing exactly how science and how comprehensive it was in terms of deeper depth into pathology and disease manifestation and what to do with it. Yeah.
Yeah, wonderful. So then when you're with a client, do you look at prescribing both exercises, yoga, and your diet, or how do you marry those two? How have they worked with your clinical experience?
Maybe it's in that way also kind of helping to understand how I started to practice as well, because besides the study, so for like almost 4 years, I worked more in a private hospital surrounding at Macquarie University Hospital. I worked directly with a gastroenterologist who hired me to provide people that were diagnosed with IBD, so Crohn's disease, celiac disease, fatty liver disease, so a lot related towards endocrine and gut health, to help them in their process of their disease, in terms of also providing them with more nutritional support. So at first, that was very much focused on providing them certain advice for colonoscopies, for instance, how to prepare for that. So, but what I noticed working in that environment was that the amount of overwhelm that a lot of these patients had once they were diagnosed or once they were going into that disease process was way bigger than just providing nutritional support. So I noticed, like coming back towards my yoga background, that it was not necessarily something physical, but it was more a process of acknowledging for them what was going on and educating them on what was going on, and also seeing that a big driver behind the disease, and not necessarily the start of the disease, but that stress and anxiousness, anxiety, sometimes difficulty to adhere to certain treatments, really led to some difficulties and some issues that actually went beyond just simply having digestive issues. So to come back after that, I also worked for a clinic where I did nutritional advice, but what I learned to see quite quickly, even though I wanted from the start, when I moved from yoga, and I'm still teaching yoga, I'm still teaching meditation, I really wanted to see how I could combine the wisdom from that part and the understanding of physical awareness, and in that way also calming the mind, how to bring that into something like nutrition, which was really hard. So my approach is also now more related towards first helping the person to understand what's happening, to bring them into a journey of deeper investigation, which can be like through pathology, functional testing, but also to kind of really see what their personal, what would be their personal prescription. So it's very much for me always about helping them to empower themselves by helping them to show how I call it, what their nature is. Every person is different, and I incorporate a lot from my own study of TCM and the process of observation through the diagnosis through observation, by helping them to also understand what their personality is, what they're bringing into it with their personality, and how to kind of align that with rather pointing out the weaknesses, also helping them to find their strengths in such a way that they can empower themselves. So it goes a little bit more. That's why I just call it more holistic.
Yeah, definitely. That's excellent. And I guess another question that I got is, how have you found that Australian view of health is a bit different to the Netherlands? Like, have you found a bit of a difference with that when you've come over, or like when you were in the Netherlands, was it a little bit more focused on the yoga? Yeah, like how has that transition worked for you, and do you think that's impacted upon your clinical practice at all?
Well, obviously, I studied clinical nutrition here, so in the Netherlands, I worked in publishing, so I worked on like weight loss platforms. It was a lot of like women's magazines, interior magazines, yoga magazines that I worked for. What I kind of found really funny is that when I was living in the Netherlands, like an aspect of organic foods was something that was quite normal. I grew up more with the understanding of eating a large variety of vegetables, for instance, and it's one of my favorite foods, but we also incorporate that in a lot of different ways, like the same as in Germany, like sauerkraut, like fermented foods. It's a very it's not an uncommon thing. So when I came to Australia, I think that coming up of organic, which was like 2010, 2011, that started to climb up a little bit more, and I think the interest in nutrition started to grow as well. But certain things that maybe might have been seen, and I'm not clear on that myself, as what was for me normal was not necessarily normal, considered normal in a city environment such as Sydney. So I don't know what's happening like outside of Sydney. Like if you go to the Blue Mountains, I know that when I was studying, like Tasmania has obviously got quite a reputation of being more like organic. So but the difference, I guess, is the awareness of food and eating more vegetables. I think that was a big difference that I found here. And I
guess the other thing that I'd be interested to know personally is, how did you go with like the climate sort of stuff? Because like obviously the Netherlands is quite a bit colder. Did you notice like a little bit of a difference with like clients and patients and doing that kind of stuff? Like how has that affected or changed your perspective, or how has that sort of worked?
I just the only thing that I can say, like my experience moving from one environment to another is obviously has not necessarily been related towards how I compare that with where I'm coming from, but just things that I noticed. At first, I found that Australian was quite laid back and easy, but coming into practice and meeting people, and also my own like well-being, is it seems, especially now also when we're in a lockdown, for instance, but it seemed to me that maybe because Sydney is such a big city and it's a very individual city as well, that what I see is like stress and anxiety and but that's maybe also because I attracted that's what I support mostly in people, is that's such a really like big contribution in a lot of the things that are happening with people. And I feel like that's more my journey, and that's more my personal way of practice, that process of helping people to acknowledge that and helping them to see that in a more compassionate way, rather than saying like, oh, you just need to toughen up, because I think that's very hard for a lot of people, because in the end, what you're creating, or what I see that is being created, is more people who in the end put themselves more into a victim role, while it's not about being a victim. It's about overcoming and strengthening and empowering some of the parts that everyone in their innate being has in them, which is resilience and inner strength.
And so then how does that come through in your clinical practice? Are you doing a lot more with the breath work? And has that breath work been taught to you through your yoga practice? Or what sort of methods then do you use to help your clients with that? Developing that?
So there's different ways of looking into it. Like I mentioned TCM. So besides being a clinical nutritionist, I also did neuroemotional techniques, which is NET. I studied a certificate in kinesiology. I didn't continue on that, but that's a part that was really my interest, because from a yoga perspective, my interest has always been into like the meridian theory, the 5-element theory for the Taoist practice, the Buddhist practices. So what I find for myself as a main part of a grid and helping people to understand is also to, like I see, to show them their unique nature, what qualities there are. And through TCM practices, rather than only through acupuncture or taking a pulse or reading the tongue, there's different ways. So one thing that I do is also called face reading. So I can pick up certain signs from a face, just purely the shape of the face, and some characteristics in relationship towards the issue that they're struggling with. So helping them to kind of map out more of that part of their nature really helps them. It can be like an entry point for me. And I do not always use it as like, okay, this and this and this, but I use it as a way of looking at people and understanding them as well. And then underlining all of that, rather than, because what I used to do in the past, especially from a medical background, is the tendency is very much to go into the research and the science, which is important, but to also almost that it becomes almost a dependence. So on paper, a treatment plan can look really beautiful and wonderful, but if the person in front of you has certain boundaries or certain difficulties with complying with it, it's more important of helping to understand why that is and how to support that by helping them to bring certain strengths or certain processes to the surface. Some people are like, I need to lose weight, I'm going to do it. Other people are, I want to lose weight, but when it comes towards losing weight and restrictions of losing weight, what you're taking away from them is that one thing that they feel that nurtures them, that gives them a certain sense of feeling whole. So you really need to find different ways of different approaches where it's not necessarily about like, okay, it's shown that a restriction or a more keto-based diet or like a low-fat diet or a low-carbohydrate diet is the best. Yes, on paper it's the best, but it might not be the best for that person. So it's all about timing, taking time, helping to step in people's rhythm and pace, and helping them to see what pace works best in that. And in that, I incorporate meridian theories as that. I also try to track emotional points. I look into muscle testing to see what might be an underlying cause. And it's very revolutionary. I find myself with those people that I work with, when that can come towards the surface. So for me, it's not necessarily like, okay, this is a diet, this is what you need to comply with. Some people see me over a longer period of time where diet is just a small amount, and the bigger amount, the 90%, is really helping them to bring more towards the surface, where they can help to relieve or release themselves from certain limitations that they might have embedded in them. So it's very somatic as well.
Yeah, definitely. Sounds awesome.
Yeah.
So what does that look like then for you? Do you prefer to have, say, a 6-month program? Like a client comes to you and you'll meet them every month, or do you prefer to have like 5 or 6 sessions straight away? How does that treatment plan work for you, and what do you like to do with your clients in terms of like lengths of treatment, how many treatments, that sorts of stuff?
Yeah.
Like, what's your preferred method for that?
Like obviously the tendency for a lot of people who come and see me is mostly stress and gut that comes out of it, because that's obviously where I come from. I also know, like, I do, like, it sounds really funny, but I do also like, for instance, things like non-alcoholic fatty liver disease, because it is quite measurable and it's quite easy to treat if you know, like, the right approaches, and that's very much also diet based, but also lifestyle based, and also looking into deeper things. But I think in general, like, I have some clients that I've been seeing for like over a year or longer, but that's also more like supportive care, I would say. And some clients that I see vary for like a treatment between 6 weeks and 3 months, probably, where after the 3 months, I might just see them every half year or every like a couple of months after that. But it just really depends. Like I said, I have one client where gut issues was a really big thing, but it was more about helping him first to bring a certain sense of structure in his life. For instance, through just simply having a diet and or having a breakfast that is more supportive towards him and helps his gut, and from there looking into more functional testing, like a comprehensive stool test, for instance, and now I've been working with him. I think we had about 4 sessions in a period of 8 weeks, which is also more based on what he felt comfortable with. To a point that we now are doing the test, and that we did the test, and that we're now having a protocol that we're going to stick with for 6 weeks, 4 to 6 weeks. So it's really, I think it's very changing and it's very individual. I wish I could be like some people more structural in that, but I feel it's very much what comes into it. And I also notice my own experience is that when I started, that sense of needing to convince people that they need certain forms of treatment had more of a counter effect.
Yeah.
So I'm also very much like, if someone is feeling oh, I can't do this, it's harder, that I can only say to that person, like, you know, I understand this is also your choice, this is your decision. I'm not going to be the one that's forcing you to say, yes, you have to stay with me, but I just want you to know that, you know, I'm here. And I think it's more important.
Yeah, definitely. It's that really meeting your client in the sort of state of mind and the state of life that they're at. So therefore you can build a lasting change, not just give them something and then they'll never take it, right? Like you can give them as many supplements as you think they need on paper, but if they're not willing or ready or trusting you, then they're just going to sit on the shelf and they're not actually going to take it. And it just doesn't really build that rapport or that trust with your clients to build those lasting changes, I've always sort of found. Is it the same with you?
Yeah, I find that as well. And I feel also in that sense, you know, I don't know about you, but I'm a person, like when you're practicing and when you're working with people, it's always that sense like, am I doing enough? You know, is this suitable for this person, or am I not doing enough? And there's also a period that you need to kind of draw a line that all that you can do is bring your presence to a person, your knowledge, and educate them in such a way that they feel that it helps. And education goes in different ways. Like when I say that I do functional testing, some people feel a really big release when you do functional testing and you say, like, you know, it's not a pathogen, it's something, it's just structure in your body, and that kind of resembles what we were talking about in terms of insomnia or stress or stomach aches when stress comes in, so that they actually start to feel acknowledged for what's happening in their life. And I you know, there's a lot of research also in placebos, you know, and when you're looking into studies, we're always looking into studies where you're looking more if a supplement or a drug, medicine is effective. But sometimes what you forget as well is that the percentage that responds towards a placebo can sometimes be quite high. And I'm not saying that I'm a placebo. Obviously, you're using science and you're working with nutrients, but I think a really big part is also giving people the confidence and the trust and the support that they are heard and that they are seen, and that is also a really big part of healing for them.
Yeah, definitely. And sometimes I think with that, when we call something a placebo, sometimes I think that's just a cover story for variables that we don't know, right? So variables that we're not measuring, and then we say, oh, it's the placebo effect. But it's like you said, it could be just the fact that they're getting heard, they're starting to relax, therefore their nervous system is, you know, going back into, you know, your parasympathetic, and so therefore your gut's starting to work better. But we call that placebo, but it's this whole other thing that we're just not measuring for in these clinical trials.
Exactly.
And then I think that's a big thing that is the problem with some of the industry, is we say, oh, that's just a placebo effect. But it's like, well, what exactly is the placebo effect? And what was the clinical trial parameters? Like, is it within the clinical trial parameters, or is it just another variable that we haven't accounted for?
Yeah. Well, there's a lot that comes into play.
Yeah, that's it, definitely.
But I think it's like, for me, the first and most important place is that I see a person in front of me, and that you can see this person, for instance, is struggling with boundaries, like, you know, with resilience on how much is coming in, how much is moving out. There's a certain sense of stress. If you're looking into the history of this person, that has been going on for a long period of time. So that without going too much into the let's say into the scientific language or into the anatomy and the pathophysiology of things, is also kind of really being straightforward in seeing what might be there. So barrier issues can relate to different things. Can be barriers like in terms of nervous system, can be barriers in terms of gut, it can be barriers in terms of immune system, and helping to kind of see that whole spectrum of contributions, rather than, because everyone is always thinking like, why am I this way? What's this? Why? But rather just helping them like, okay, this is the state at this moment, and this is what we can do for you.
And I think it's one of the advantages of natural medicine is that we really can put the human back into the medicine, right? Like the human's at the forefront. I think sometimes, and this isn't a criticism, but there's sometimes through the Western medical system, it is more numbers on a page. You're reduced to numbers on the page, and if you're within these numbers on the page, then you're a healthy human being, and that's it, and you're out the door. Whereas I think the advantage of natural health is that we can actually put you as a person in that middle, and we can talk to you. Well, like, what's going on with you? How are you feeling this? What's your experience been? And we can actually start to unfold that little bit more human aspect rather than just reducing them to the numbers on the page.
Yeah, and I think also like bringing it back towards resilience or inner strength. I'm not saying that that's a society thing. It's just more something that I notice myself, as a yoga teacher, as a practitioner, but which I also notice with people who come and see me, that sense of that it's almost not allowed to be vulnerable, for instance, and to be in touch with that sense of vulnerability. And I think inner strength comes from being in touch with the vulnerability and helping to also see how that can be supported through different ways and different methods. Like, I'm not saying like, okay, naturopathy is the holy medicine, and nutrition is the holy medicine. It's a variety of different things, and it is helping to come into an area or into a space of support that's most suitable for that person at that moment, so that they can move forward and they can also find resources out of that vulnerability in how that can help them to strengthen. It's like gardening. It's like I said, it's like nature.
Definitely, yeah, 100%. And I think that's so important for us too, as a natural therapist, is to have this network of support so that we can know where our limits are, and we can actually start to, refer our clients on, and then so they can go to people who maybe have that bit more of skill sets that they're looking for. And when you build this network of support, then you can get your client the best need that they need at that one time. That's what I've sort of always noticed.
Yeah.
And so, so it's like that you said, it's like that whole landscape.
Yeah, and I think it's what you said before. It's bringing the human aspect into it as practitioner, but also for client.
Yeah, definitely. Well, thank you so much for coming on, Jan. It's been wonderful. Where can people find you if they're looking for a client, or if therapists want to contact with you and have a bit of a collaboration and bounce some ideas, build this network up?
So I just opened 3 months ago my own clinic, which is called Upaya Wellbeing, and it's also a clinic that, like what we were talking about, really highlights that sense. Upaya means limitless possibilities. So it's not only a clinic that focuses on, for instance, nutrition or naturopathy, even though we have it, but there's also kinesiology, there's Reiki, there's massage. So it's a clinic that offers different forms of modalities in such a way, psychosomatic therapy, that all these different modalities together can help to offer people the skillful means for themselves to enhance and get better. And that's in Sydney in Rozelle. And besides that, I have my own website, which is the Holistic Health Coach. So you can reach me through my business,
perfect.
or you can reach me personally through my other website or through emails and Instagram, obviously. But
Awesome.
What to say about it?
Yeah, no, definitely. And again, as always, guys, the links will be underneath. And so, feel free to contact Jan through that. But we'd just like to say thank you so much for coming on Therapist Spotlight. It's been absolutely wonderful.
Thank you very much for the invitation, Josh.
No dramas. And anybody out there who's around the Sydney area, around the world, and wants to get in contact with Jan, just please, send him an email, and we'll bring some clients down, because it sounds wonderful what you've got on offer.
Thank you.
No worries, guys. So, as always, we'll catch you next time, and take care of yourselves. Bye now.
Thank you for listening to Therapist Spotlight. If you would like to know more about ANTA, visit us at www.anta.com.au.